on the cat. Okay. If we remember our chest muscles, this muscle right here that goes all the way to the arm, this is the pecta antebrachialis. Okay. To see the biceps brachii in the cat, you have to peel that one back. Okay, and then underneath the pecta antebrachialis, you have the biceps brachii here. Now, right here, cats have a muscle that humans don't have. This is called the epitrochlearis. You're going to have to peel it back to be able to see the triceps brachii from the medial side. Okay, you don't have to peel anything back to see the triceps brachii from the lateral side. Okay, but this is the epitrochlearis right here, and then triceps brachii underneath. Okay. When you flip to the lateral side here, okay, basically everything you see here in the upper arm, this is the triceps brachii of the cat. Okay. Now, to see the deltoids, I sort of use the triceps brachii as a landmark, I guess. Okay, so the triceps brachii goes like this. Notice that there's a muscle right here that sort of comes right across the top of it. Okay, this is the spinodeltoid. The spinodeltoid goes right across the top of the triceps brachii. Okay, now the cat has this deltoid muscle in the shoulder that looks a lot like our deltoid muscle. Okay, this is just the clavodeltoid, however. Okay, right here. You can see it from the back here. You can see the clavodeltoid above the pecta antebrachialis from the front here. Okay, so that's the clavodeltoid. The acromial deltoid is going to be this muscle sort of deep to and between the clavodeltoid and the spinal deltoid. So this stuff here. You guys are going to have to clear away some connective tissue to see it. I cleared it away already. Okay, but it is deep. It is underneath the clavodeltoid and the spinal deltoid. So right here, acromial deltoid. Okay. Now, when you go into the forearm of the cat, remember with the human, I started with the brachioradialis. This is going to be the brachioradialis of the cat. This is the one I accidentally ripped. But what you can see is that the brachioradialis comes from way up here, whereas all the rest of them come from down here. Okay, so the brachioradialis is going to come from up here. The other thing about the brachioradialis is it typically hangs off from all the rest of them. You can easily separate it, but it usually is covered by a whole bunch of connective tissue and fat and crap. So you're going to have to clean it to make it visible, but it does hang off like this. Okay, that's the brachioradialis. Okay, so then when we move towards the lateral side, I really need. Do you guys have a probe or something?
We don't know. A probe. Probe, no.
Or I could use that. Yeah, I can use that. Okay. So the very next muscle from the brachioradialis is going to be this one right here. Okay, that one right there. That's going to be the extensor corpi radialis. And you can sort of see that their origins are like right next to each other. Okay, extensor corpi radialis. Next to the extensor corpi radialis, okay, you have that muscle right there. That's going to be the first of the two extensor digitorums. Okay, since this is on the medial side, it's not the lateral one. Okay, this is the extensor digitorum communis. The one next to it is the extensor digitorum lateralis. Okay, and then the final muscle from the lateral side here, this is the extensor corpi ulnaris. Okay, extensor corpi ulnaris. Now I rotate to this side. This is where the medial epicondyle is, so this is going to be the flexor side. Okay, so right here would be the very next muscle. Right here would be the very next muscle. That's going to be the flexor corpi ulnaris, right here. Okay, the one next to the flexor corpi ulnaris is this humongous one in the middle that goes right to the palm of the cat. That's the palmaris longus, where I told you it would be huge in the cat. Okay. Then next to that, you guys might see two muscles here that they might separate like they did here. This is going to be the flexor carpi radialis. Technically, there's a brevis and a longus. That's why you're seeing two separate ones. They're technically two separate muscles, but you guys are just going to name them as one single muscle. Finally, what you should notice in the cat is once you pass that flexor carpi radialis, you might see like a wall of connective tissue here. Okay, that wall of connective tissue is on the pronator teres. And notice that the pronator teres here sort of goes in a different direction. All of these ones go like this. The pronator teres sort of goes off to the side like this. Okay. And then when you rotate back again, that's the brachioradialis right there. It would be right here. Okay. So that's the forearm. Good?
Yeah.